Welcome to the Selfish Griever podcast. Today's guest is somebody that I was really interested in inviting to speak on the podcast because I think that therapy is something that really helped me a lot. What was definitely an area that I was unfamiliar with prior to my grief journey. And Carol is the one that I ended up working with for about a year, and she helped me tremendously. And I think that she could share some insights from the perspective of the professional side of therapy as to what people on a grief journey should be considering or looking towards. So Carol, if you'd like to introduce yourself.
Yeah, thank you, Whitney, and thank you for inviting me to come on your podcast. It's a little scary and exciting both at the same time. Just by way of introduction, I am a licensed clinical social worker and have been in practice since about 2001. I think that was when I got my MSW, so it would have been about 3 or 4 years after that, after I was supervised. And I'm licensed in Arizona, Virginia, Maryland, and DC, so I can meet folks virtually in any of those locations. But I also think it's really important to let people know that I didn't get to this profession just because, that looks like an interesting profession to be in. I myself experienced the death of 2 infant sons shortly after their births, and they have sort of been guiding my path ever since that. So even though I didn't start down this road right after the second one died, I think ultimately that's kind of why I got into this profession.
Carol, do you mind sharing what your sons' names were?
Absolutely not. My first son, his name was Matthew, and he died 40 days after his birth in 1986 from heart complications. And my second son, Daniel, was born a little over a year after that, and he was a trisomy 13 baby, so that's a genetic issue, and he died 2 days after his birth.
Yeah, I remember from when we met that you had shared that you'd had your own child loss and that it had been, quite a few years prior to us speaking. But for me, that felt like it meant that you could relate to, what I was feeling as a grieving mom. But I'm curious from your perspective, is that a realistic expectation for grievers that they need to find a therapist who's experienced maybe not loss of a child, but their own kind of, extreme trauma, grief? Or is that, not necessary for everyone to be able to get services that really meet their needs?
That's a great question, Whitney, and I think that's very personal and unique to each person. The thing is, we all experience grief, right? At some point in our lives, there's no way we cannot experience grief. I think it's more to do, for me anyway, if I'm going to work with somebody, I want to know that that person not only has experienced grief perhaps, but also that they've worked with it, haven't just tried to bury it someplace essentially, or pretend that it didn't happen. It's an interesting question too, because say for instance, somebody is struggling with alcohol abuse. Do you need to find a clinician who's personally struggled with alcohol abuse? I don't think so, if they're trained well enough in these areas. So I do think it's really important that somebody be trained pretty well in the area in which they're working.
Yeah, that makes sense. I agree. Even all kinds of ways that people get counseled through things like if you get a cancer diagnosis and you're getting counseled through chemotherapy, do you need to go to a doctor who's had cancer before and experienced chemotherapy to be able to be supported? No, that's not something we expect. But I do remember from my experience, because I worked with a previous psychiatrist, I think that's what I'm going to call her my memory is like foggy from back then, but she didn't, the greatest like grief that she could relate to was the death of her cat. And I can appreciate that that was hard for her, and she, was very emotional about it, but it did not feel appropriate to compare that kind of grief to mine, or to come from that place to try and support me in my grief. And that was hard. And so then when I really stumbled upon you, and I didn't know that about you before we started talking. I think that came out. I don't remember if it came out in the very first session or not, but it's not something that I think therapists necessarily advertise, or counselors. And so trying to figure out how you navigate, like I just felt like I got super lucky. and I don't know if that's that everyone gets that lucky.
Yeah, it's a good question. And I think also, just being, when you're looking for therapists, are they at least mentioning or noting that they have some training, some expertise, some background in grief work is important to move forward. And also, the other thing that you mentioned that strikes me is if I mention that I've experienced a death like those, it's one thing for me to say something within the context of the relationship with the client, but it's another thing if I then take the rest of the therapeutic hour to go into great detail about my loss, and or reinforce, like talk about it all the time. Like the session is not about me, so I might put it in there to just perhaps, if it seems relevant and important for the client to hear that, but then I'm not going to stay there and talk about it. Does that make sense?
Yeah, that makes sense. I mean, it does now with my perspective, but definitely my first therapist was not like that. And I just didn't know any better. You don't know what you don't know. I'd never gone to therapy before, and I just kept really, I guess, giving my power away and thinking like, oh, it must be that I have the wrong impression of what therapy should be, or it starts out this way, but it's going to get better. And I let it carry on. It was, I think I did 4 or 5 sessions, but that was still too much. Like I let it carry on further than it should have, especially when you consider that that's, 1 session a week. Then that was over a month that I continued talking to her while I was in this very impressionable, vulnerable state. And that, yeah, it really just was not, now looking back, I guess the benefit is that I have that experience, so I can speak to it here, but it's not the way that I should have done it. Where are the places that, if somebody's looking for those kinds of specialties in therapy and counseling, where are some places you recommend that they should look?
So there's a couple of I think, good resources. Not every therapist is going to be listed on psychologytoday.com, but it's a good place to start, because you can go online and type in whatever area you're living in. It will bring up a list of therapists. There should be other things that you can click on the website to sort of narrow down the options. So you could even click on, I'm looking for a therapist who speaks to grief. And then you can go and look at their bios and read a little bit about them and get a sense. Because a lot of times they'll put in, I work with grief, but when you go to their bio, they really don't speak much to it. So it can start to give you some ideas. And they often have websites that they can, put on the psychologytoday.com page, so that you can click on their website, go check them out further. That's one place to do it. Another, I really think just checking in with your family, friends who's used a therapist. Who do they recommend? Why do they recommend them? Anybody you know that you feel comfortable asking that question of, I think is a great space to go. Also, I am actually on a therapist listserv So there's there's well over 1,000 therapists on that listserv, and if people write me and say, oh, I need somebody who needs this, that, or the other, I can plug it in and say who's doing that, what insurance might be important, if they need to use insurance, that kind of thing. So that's another way. So there's a couple different ways.
Yeah, I remember it feeling really overwhelming. I come from a family that does not do therapy. Therapy is not even a word like in our vocabulary. So I didn't know anybody who'd ever done it before. I had no reference point. And I don't even know how I knew so strongly that I needed therapy. I think I just looked around and felt like I didn't have anybody to talk to. And I needed somebody to talk to. And somebody I was hoping who could, I think, even maybe help explain to me a little bit about like what was going on, or validating like it's okay, that's normal, or I don't know. I just was so bewildered and lost, I think, in the whole experience. So it was overwhelming to look around at lists. I went first through my insurance, and then of course they provide this whole list and of, I don't know, like 18 or 20 local therapists, but then it turns out there's only 2 or 3 actually accepting patients. And it was exhausting to repeatedly tell my story to strangers when I was at this point where everything was so raw. I mean, it was just hard to say out loud that my son had died, and that was why I needed help. And I'm glad that I persevered, but I can see how that could be a stumbling block for a lot of people to begin with, that they just
For sure.
can't do it.
And let me just say, the thing with the insurance lists, so they're only going to list people who have contracted with them to provide services, and often they don't keep them updated. So you could call the therapist and say, oh, I saw you were on my Blue Cross Blue Shield insurance list, and they're like, oh no, I'm not taking that anymore, but they haven't been removed from the list. And you're right, I think this is a really hard time, especially now, to find a therapist that is taking clients. Often they are overwhelmed themselves with the sheer number of people. So perseverance.
Yeah.
Yeah.
And it feels like, which I don't have any personal experience in, so I can't really speak to, but just it feels like there's cropping up more and more of these apps, and this concept of like, oh, you just can text your therapist whenever, or I don't even understand it all. I look at it and think like, that's, for me personally, I need to like at least see over Zoom or feel this connection. I couldn't do something that was that I don't know, removed, I guess, from me.
Yeah.
But what are your like thoughts on those services?
I don't know that I can speak to that. I am concerned with that, sort of along the same lines that you're talking about. My question is like, is it really the therapist on the other end of that text? A qualified person. How do I know that if the person is appropriately licensed and, located in my state where I am also sitting? And it's the middle of the night. Why are they answering that text? It is concerning.
Yeah.
And typically, what I do hear from the ranks of therapists about these services is that often the people who sign up with those organizations are not paid well and are not really given sufficient or good enough time to work with people. So they're really more of a business organization than a mental health organization, is sort of what I'm hearing in the scuttlebutt about these kinds of services. So you have to be pretty leery, or at least curious about them.
Yeah, I mean, and I can see the attraction because they're trying to, fill that void, right, between access to services and also cost of services and the need. But I agree with you. I don't know that would be the solution that I would look for. So, but I am curious about if you can speak a little to, because I'm probably even bumbling this up, but the difference between like people who call themselves like psychiatrists versus the therapist versus the counselor is, if somebody's just starting out, should they be concerned about looking for one particular type over another, or is it more about just finding like whose bio you resonate with and that you feel like you'd be comfortable speaking to?
Yeah, absolutely. So there is a difference between therapist, counselor, psychiatrist, psychologist, mostly in the level of education that they have received. So therapists and counselors, actually those two terms are usually both within the therapy world, but also outside of the therapy world, sort of interchangeably often used. But often a therapist is somebody who's trained to do a lot of diagnoses. So they understand the DSM-5 TR and how to label and support a particular type of diagnosis, whereas a counselor is more focused on behavioral changes, day-to-day life resources, sort of supporting people from I need to work on my decision making, that kind of thing. But they also intersect a lot. So most of the time when I'm working with a client, I don't focus a lot on the diagnosis piece. I do provide a diagnosis for insurance purposes, but I don't get caught up in the diagnosis piece. I'm more concerned with how are you managing your life on a day-to-day basis, what is happening for you, how can we support you, what resources, those kind of things, right? But both of those therapists and counselors they all have master's level degrees. They've all had to take a qualifying exam, had to been supervised and licensed in their appropriate state. So they're all similar in that. Psychologists also usually have PhD level training. So another notch above. The issue with that is, of course, their price is also going to be more. So if you look, for example, in Psychology Today and you see a social worker, her fee, let's say, is $150. And if you look for a psychologist, you'll probably see the fee more like $200 to $250. So there will be a difference there. They have a little bit more training. Psychiatrists are the only one of the bunch who can prescribe medications because they are physician trained. So they really are physicians who are specifically their area of expertise is the mental health psychiatric medication piece. Does that make sense?
Yeah, that does make sense. Yeah. Yeah, and I didn't take any medication. I actually refused because I was it was part of my trauma, right? Because Orion died during the night and I felt like I, wasn't there. If I had been there, that maybe I could have done something. For a long time I told myself that story, and part of my trauma was sleeping and worrying that something would happen to Maverick while I was sleeping. And I just didn't want to be altered in any way, even, during the day. So I refused to take any kind of medication. And thankfully for me, I managed to come out the other side. But so does that mean if there's somebody who maybe starts working with a counselor or a therapist, and then at some point during their work with them, it becomes recommended or maybe obvious that they need to consider or explore a medication route, that they'll need to switch? Or do they just contact a psychiatrist and then work with them on the medication piece?
Yeah, they wouldn't necessarily see. The thing about psychiatrists are that yes, you go in for your initial consult typically, and they do a whole assessment and work with you in terms of the type of medication that would make sense. But then typically, they'll not meet with you very regularly, and the appointments will be really focused specifically on the medication, not on the ongoing support that you might need, that you would receive through a counselor, a therapist, or a psychologist. So typically people will see a psychiatrist just for that added additional piece. And also sometimes PCPs, regular general practitioners can prescribe some of these medications. So they wouldn't necessarily have to seek a psychiatrist's services. It's going to be sort of up to them what they think makes sense.
Well, that makes sense. So if you're concerned that that's the route you're going to need to take, or you don't necessarily have to immediately seek out the psychiatrist who's the more expensive option, you could still start with a counselor or a therapist. And okay, yeah.
And if I thought, as I was working with somebody, that adding some sort of psychiatric medication might make sense, then we'd be talking about, do you have a psychiatrist? Do you know somebody you can connect with? Do you want to talk to your PCP about it first? Whatever.
Not that there's like a specific list, but what are some things that maybe are indicators that considering therapy would be a good option for you?
My core belief about grief is that it is a natural process, right? And that we all experience it, and there is no quick fix for the grief process. We can't go around it, we can't jump over it, we just have to go through it. And I think there are some things to be aware of that might be helpful in the context of what you're speaking to, Whitney. But even before I go to that, let me ask you, why did you think you needed it? What really was happening for you that spoke to?
Well, I didn't have anybody who it felt like really held space for me to talk about my grief. It would become about them, either what their feelings were, their grief, or my I guess discomfort, that's the right word, with my emotions and feelings. And not from a judgment perspective, but in like a defense perspective, that then I'm not soliciting their advice for how to handle things if I'm witnessing that they're rarely handling things healthy in their own life, or I'm not concerned with what their opinion is if it differs from mine, if I look at them and think like, well, you don't really know how to support me, or I don't see you support anybody else either. And like I said, I didn't grow up with a family that talked about feelings. We didn't have self-awareness. Everything was just like, well, life's tough and you need to get over it. You need to move on. And I come from a divorced family, so my parents separated when I was 14, so I probably had plenty of opportunities early on when I had a lot of feelings and emotions, and I didn't have anybody to talk to about them or anywhere to put them, and was just kind of expected to like accept it and get over it, and like that's just how life is. So when I was in that really extreme place, I didn't even have anybody who could be like a temporary crutch that kind of halfway fills the void until you realize like, wow, I need something more constructive. And I do remember thinking like at some even minimal, like even if it was only 2% of my being at the time, but there was still that 2% that was thinking like, I need to figure this out. I've got to find a way to make it through this. And I didn't know how to do it on my own. And so I needed, and I mean, you were one of like many resources. I read a lot of books, and I eventually ended up doing EMDR therapy because I I guess I say this about myself, and then sometimes I think, like, wait, did I have an official diagnosis? Am I supposed to have an official diagnosis to say this? But I had, PTSD. I didn't sleep for the first year, that at least, after Orion died, and I was terrified to go to sleep, and I like wouldn't even lay down in my bed. I just sat on the couch and like watched TV and tried to numb out until I finally like couldn't keep my eyes open anymore, and I'd fall asleep for a few hours and then wake up startled, like realizing that I had fallen asleep and start over again. So I was not at all in a healthy place that was sustainable long term. But
Yeah.
I
So you're identifying quite a few of the.
But that was also really extreme, and I don't think that that's the only case that a therapist could be beneficial. So what about the people who are like
Not as extreme.
going back to work? I mean, I was not leaving my house for a long time. I was terrified to be left alone with Maverick. And then finally when we, did get to a point where probably about the time that I started working with you, that I had to start taking some responsibilities, because everybody else couldn't stop everything to, be there for me. Like my husband at the time had to go back to work, and my mom moved back, and my sister had to go back to Denver. So I had to start like driving Maverick to go to preschool. But I mean, that was it. I drove him there, and then I came home for 3 hours and then went and picked him up and drove him back. I didn't do anything. I didn't talk to anybody. I was I insulated myself.
Right. So I think that's one of those indicators, is when you notice you're really isolating yourself. Grief is hard to begin with, and when we isolate too much, it's just going to get exacerbated to the extreme. But I think often when we're grieving, that's what we feel like we need to do. So it's, how do we find the balance? So, yeah, and I think one of the other things that because of the culture we live in, that people don't give us very much time for grieving. It's, you've been doing this for 3 weeks, and as you spoke to early on, I'm not comfortable with your grief anymore, so like take it someplace else, please, or stop doing it because I'm uncomfortable with this. And so I think one of the great spaces for counseling and therapy is an opportunity for people to know, I can go and talk to somebody, and this is so important in the grieving process. I can talk about it over and over and over again until it starts to lose some of its intense, high feelings, and be able to start functioning in my life a little bit better. Yeah, maybe I am going back to work. I've certainly known many grieving people who do return to their jobs fairly quickly after the death, and they're functioning, but they're not functioning usually anywhere near the level that they had been functioning at. And often they don't care. They've sort of, don't have a lot of motivation to do this. I don't really care that I'm here. All of those kinds of, when you notice those kinds of things coming up, I think those are really great, reasons to sort of think, maybe I could use some support. If you're feeling terribly overwhelmed in a way that's getting in the way of day-to-day living, and you're not doing what really needs to just, not getting up, making dinner, and taking my kid to daycare, doing the general things that really need to happen. Not sleeping is another good reason to is another good indicator that maybe some counseling might be useful or helpful. Feelings of I have no control over my life, and just the big changes that keep happening that we have no control over. Feelings of shame, feelings of guilt, intense guilt. You sort of spoke to that a little bit when you were talking, grief is hard enough without opening the door for all of these additional like feelings of shame and guilt to come in. And the what ifs and the shoulda, coulda, wouldas are at high level, right? Especially in these traumatic instances. So just having somebody that I can go talk to that person and they are going to listen and hear and let me tell my story as much as I need to, as often as I need to, and I don't have to worry about, burdening them. A lot of times clients who are grieving will say, I don't want to burden my mom with, talking about this. I don't want to burden my friend with talking about this all the time. And so it's a nice place to be able to no, I can go do that. It's safe to be able to talk about it. If you lose interest in the world entirely, it's one of those indicators.
And also, what about if you, I guess maybe notice that you're feeling stuck in your grief journey? Like you maybe were making progress and now you're like can't get over the anger, the resentment, and it's been maybe years since your child's passed and you're not doing any better or differently than you were, the first month after.
Yeah, if you feel like, if I look at my life now and it feels like it's exactly the same as it was right after the death or pretty close to it, then great indicator that maybe I should go talk to somebody because something hasn't moved. For sure. Yeah. For sure.
And it's interesting too because a few of the things you were speaking to, like isolation, I was thinking about that I learned so much about myself through this grief process, and that now I would say that I spend way more time by myself than I ever did before. And in a way, people will perceive that as isolation, like, oh, Whitney, you should get out more. But for me, it was this revelation that I used to think I was this extrovert and loved to be social and around people all the time. And now I've recognized how much energy that was actually taking for me to do that all the time. And that I really don't enjoy, depleting myself in that manner. I don't know that I'm an introvert, but I've just come to appreciate that I can be with myself and that's okay. And that's been a big change for me, socially, that there's just not this, when I was younger, there was this push, and also life shifts and changes, but I was like, oh, what's a happy hour I can go to and like meet up with all my friends, or what's the mixer I can make it out to, and where can I go meet people and socialize? And and now I'm divorced and single, and there's that propensity again where people are like, oh, but you need to be getting out and meeting people and like doing stuff and going places. And a lot of times, there are things I do want to do, but there's a lot of things that I used to like to do that I just don't hold any interest for me anymore. And I wouldn't say that that's unhealthy. If anything, from my perspective, I've gotten a lot healthier. My overall contentment in life is more so, even though some of those activities that I used to like, I don't do anymore.
Right. So it's almost like you learned how to get more comfortable in your own skin with who I am and what I'm comfortable with, which I think is very different from withdrawing entirely, right?
Yeah.
And not really knowing, is this the right place for me to be, or am I just like trying to not be around anybody? For whatever reason. So there's a difference, I think, in that, and you got to that because of some of the work that you did on yourself. So you got to a better place of understanding about what is right for me. Right?
And understanding it so deeply that I'm not swayed in my perception of that when somebody tells me like, wow, and you really stay home a lot, like, don't are you sure that's healthy?
Right.
And I'm confident with like, it's healthy for me, like that it's what I need to be doing and how I like to be, and that's okay. And also, another piece of the evolution was letting go of a lot of relationships that didn't serve me anymore, and sometimes not even because the people were mean or awful or horrible, but it was just all this stuff that was like taking up space, kind of like hoarding. Like, oh, this is nice and shiny. I'm going to keep this, and I'm going to keep this, and I'm going to keep this. And there was no depth to it. There was no, I wasn't getting anything ultimately out of it. And it was okay to put that down and let it go. And then in other cases, there were relationships that were just purely unhealthy. And I was like, I can't do this anymore. And I can't put any more energy into hoping that it's going to change. Like, just recognizing it for what it is. And I wish you the best, and I'm going to go do my thing. So
that speaks to, therapy can be a really great place to learn, to gain a better sense of your own self-worth, to become more comfortable with who you are, and then also how to set boundaries around other people that are appropriate, right? In really kind ways.
Yeah. It's funny because before, when I would hear, oh, you need to set boundaries, like, it just always envisioned to me like, oh, you put up this wall that blocks off like the horrible people, right? Like oh, you're toxic, I need a boundary, you can't pass anymore. And that's not, now I have a much more nuanced version of what boundaries means. And you're right, it doesn't always have to be, I cut you off and I never speak to you again.
Right.
It's just a different, and sometimes it's the boundaries, for me, sometimes it's the boundaries I set with myself. Like, don't let myself get sucked into, oh, but Whitney, you really should, it was just so nice of them to invite you. You really should show up. You really should make yourself go, even though you don't feel like it. Like, no, I set this boundary now. Like, if I don't feel like it, I don't do it. So.
Right. Absolutely. It's like after, losing a child and you keep getting invited to baby showers or something like that, and being able to say, and having somebody tell you, you know what, it's okay to not go, or it's okay to go and make sure you drove yourself and leave when when you start to get uncomfortable. Like, it is okay to do those kinds of things, right? The other things I just want to quickly mention about, if you're, for instance, find yourself overeating or eating, to just, what do they call, emotional eating, excessively abusing any kind of substance, that's another good sort of red flag indicator that maybe I should be talking, with somebody. And if you have a history of depression already, anxiety, or any of these mental health issues coming into the loss, those you need to be really aware of, that the loss can re-trigger a lot of those.
Yeah, and that emotional eating piece, I think, can be tricky because I'm an emotional eater, but at the time I didn't look around and feel like I was just constantly eating, and I don't think I was, but I also had this combination of absolutely not caring at all about what I was eating, feeling so unmotivated to eat that I was only enticed by eating the things that were like the high carb, the sugary, the fried, right? The stuff that's like, and that really feeds into that, was it dopamine or oxytocin or whatever hormone that like, oh, that's good, which is super fleeting, but you subconsciously seek it. So for me though, the indicator that I was emotionally eating was I gained 30 pounds in like the first year after Orion died. And not that I really cared about it, but I could clearly see like my clothes didn't fit anymore and I had to get different clothes, and those things were much more clear indicators than, that's weird, I've eaten Oreos, every day at 2:00 for the last 5 days in a row, and I never used to do that before.
Yeah. And another indicator also could be stress within relationships, right? And death loss, especially, I think, for parents. Losing children is particularly hard on relationships, spousal relationships, and so it's important to just be aware of what's happening, I think, in the context of our relationships, but also relationships with people at work, relationships with friends. You mentioned, that it does give us the opportunity to sort of look at those relationships and be like, is this somebody that still is somebody that I want in my life, that is a good relationship for me to have in my life, or and there's, again, not making a judgment about the person, but rather just saying, maybe this relationship has come to an end. Mm-hmm. But doing it in a way that's curious and conscious as opposed to reactive.
Yeah. Yeah, I think like if you're feeling like everybody's insensitive, you hate everyone, just always says the wrong thing, and it's absolutely everyone, you need to consider if you are the common denominator. And not because I think that, I really believe, because I struggled with this, where I felt like there were a lot of people in my life that were just like, they just threw up their hands and were like, well, I don't know what to do. Mm-hmm. I don't know, I don't know how to support you in your grief, so I just say nothing. And it's not my job to educate everybody on how to support grief. Like, because, the honest truth is I didn't know how to support my grief either. I had to go find the resources, the books, in this day and age, like, just Google, right? Like, you can find websites and you can find people who give valuable information even on social medias that are in clippets in like a 60-second, you don't have to like invest a ton of time and energy. But I do have a responsibility to communicate when something's not supportive to me, setting not just boundaries, but also expectations. Like if I would like for someone to talk to me about Orion, then like letting them know it's okay to talk about Orion, that it helps me, it's not hurting me. And if you're not in a space where you're doing that, then to me it's unrealistic to expect everybody to just know that and then you be mad at them when they're not doing it. Mm-hmm, mm-hmm. So, and it takes, like you said, a kind of curiosity about it. Like, wait, is this really because every single person I know is emotionally void and immature and can't, show up? Or is it because I'm like contributing to this dynamic, and what could I learn to help myself so that I'm not just alone or frustrated all the time with everybody, that I'm feeling like I'm not getting the support that I need.
Right. Yeah. The other thing you just mentioned, there is some really great resources out there for sure. And there's also a lot of bad information out there about grief and the grief process. So I think for me, part of my job as a counselor in this area is to talk about grief what it is, how to be supported by it, and not to get caught up in particular grief theories and, what stage are you at,
Yeah.
type of thing. But to help people be curious again and questioning around what they hear and read about. Does that make sense to you? If it works for you, maybe that's fine. But let's talk about it, right? So that, to me, is another purpose or reason for being in this field, is to help people understand what grief is, what it's not, and, how to work with it and be in it in a better way, right?
Yeah. And something else that I wanted to talk to you about was spirituality and people who are feeling aligned with that, and whether or not bringing that into their sessions should be a safe place, or whether they should, if that's something that's already important to them when they're starting out, looking for services and support, if they should be seeking counselors that are aligned with that too. I know that I see, I remember when I was looking back, seeing therapists who would mention God and a higher power, and them, believing and supporting you in faith. For me, the word God is triggering, so I don't, identify with that. So when I see, that specific verbiage, I'm like, nope, you're not for me. Like, I don't want to talk, But I don't know if that was, I never went that route. And I can't even really remember whether I I feel like I maybe mentioned some things to you when we were in our sessions, but I also feel like I was holding back. But I also was in a place where I wasn't really even confident yet in my own beliefs about it because all of it was so new to me. Like getting the signs from Orion, I know I was already getting signs when I was talking to you, but I just don't remember specifically like delving into that deeply in our sessions. So I'm just curious your perspective on that.
Yeah, no, I do remember us talking about signs that
Okay.
yeah, I do think as a grief counselor to begin with, when I'm like sort of assessing where people are in the beginning, that part of my job is to sort of be curious about that part of them. You know, is religion important to you? Is spirituality important to you? How does that play out in your life? How do you, is it a value? I mean, you know, everybody's very different, and sometimes with these types of losses, people may have been very, say, church going, or you know, really look to their religious or spiritual piece, and because of the loss, that may sort of send them over in the other direction for a time. So just it always helps me as a clinician to sort of know where they're at with that piece. And I think any good counselor would explore all different areas. But, you know, to me, like talking about signs from our loved ones doesn't, I mean, it's a spiritual space, but it's not necessarily a religious space. So I'm always, and I've heard so many wonderful stories over the years of people, the types of signs they've seen, and I'm a total believer in whatever's coming up for you. Let's explore that. Let's talk about it. Why is it important? You
Yeah.
know, and again, to me, that would be what I would want, right? If I was going to a clinician, I would want them to be at least open to the exploration of that, if that was important to me.
Yeah, that makes sense.
Yeah.
And so speaking along those lines, are there any like red flags that somebody who's getting services from somebody should be watching out for? You mentioned one already about like if they're talking too much about themselves. But what about, is there anything else that if this is happening routinely in sessions, like maybe you're not a good fit? And that doesn't have to mean that that's a bad counselor or you're a bad patient. It's just, you know, like anything, like friendships. I don't know. I even compare it to like hairstylists. As women, I know will relate to this, but like I can't just go to any hairstylist. I have to go to one that I click with, that understands like my vision when I go to get my hair colored and what direction I'm trying to go.
Yeah, absolutely. That's a great analogy. I hadn't thought about the hairstylist, but yeah, you're right. Um, I do think, you know, when you first start meeting with somebody, you should go in with some sense of curiosity and just kind of let's give this a couple times to see if this is going to be a good fit. And as you said, like, I'm not a good fit for everybody, and I'm very, you know, I'm very clear about that. And I have no ego around that, or very little. I try to keep it, you know, out of the space. It's like, yeah, it's okay. We don't have to love each other, and we just, there's no connection. Whereas other people, it'll be like this immediate and pretty amazing click. But I think, you know, my favorite are people coming and telling me, oh, I was seeing this therapist and they kept falling asleep. Really? I mean, it sounds like I'm amazed, but I've heard that enough, you know, about different counselors that people saw that I'm like, okay, well, that would be a red flag. If they seem bored, if they are falling asleep, if they're not really, if you know, not looking at you, even on Zoom, or like answering their phone, those are all huge red flags to me. If they seem a little overwhelmed, or like they're just not present for the session with you, that would be a red flag. If it feels like there's not a lot of empathy happening in the space, if for any reason you feel unsafe at all, and I don't mean necessarily physically, but just have a sense of this person is judging me all the time, and I just, you know, not sure why that is, but there's a feeling of that. If you feel like you've been doing the therapy for a while, but there doesn't seem like there's any movement happening for you, like sort of the stuck space you were referring to before, like I'm still stuck. I started this therapy, here in February, and it's now September, and I don't see any movement happening. Of course, I'm a strong believer that a lot of the work is the client's job, not the therapist's job. But that being said, if the therapist isn't helping you to sort of be curious about what is happening here, and they're just repeating the same things all the time, then maybe that's not a good fit. Any breach of confidentiality, of course, there's some really big flags like that. If you hear somebody talking about you that's in the grocery store that you're like, how did they get this information about me, right? What else? If they accept gifts that really are inappropriate to be accepting, have relationships with, basically we call them dual relationships, so they're not, the therapist isn't your friend, right? Mm-hmm. And that kind of relationship should not be suggested from the therapist, or sort of that they find that acceptable. So say, for instance, a client was to say, hey, I'm having a birthday party for my son, would you come? I'd be like, I really appreciate that invitation. No, I think that wouldn't make sense for us, right? Because I'm not a friend. I'm a counselor for that person. So that would be another type of thing. If the therapist just keeps asking questions and doesn't seem to be listening for answers from you, they just keep interrupting with more questions, giving advice, unless specifically asked for. And even then, I try to be a little leery of, if you're asking for advice from me, what is it you're really looking for here, right? The answer that might be right for me is not necessarily going to be right for you. Mm-hmm. So, unprofessional, disregarding your values, not paying any attention to your questions. These are all sort of, they seem little, but if you see a lot of this stuff happening repeatedly, big red flags.
Yeah, I remember with my first therapist, besides just the cat thing, I felt like the first 3 sessions that she just wanted me to keep repeating the story. Like tell me what happened and how. And I know that there's, theory about that, and you mentioned it earlier too, like the more that you can talk about it. But also it just felt uncomfortable. It felt like it was me like reciting through over and over this list of scenarios, and it was like more traumatic for me than it was helpful. And I remember feeling like, I don't like doing this does not feel good to me, and also thinking in my head like, well, Whitney, this is what you need to do to work through therapy. Like, this is how therapy works. It's not always going to be comfortable. You're going to have to do stuff you don't want to do, or so I had those dialogues going on in my head. And then later, towards the end of working with you, I worked with an EMDR therapist. And I don't remember how I found her. And the EMDR therapy itself was effective. I only needed to do, I think, like 3 or 4 sessions with the actual technique. But when she took me on as a client, she had explained to me that she offered what she called talk therapy or EMDR therapy. And so I would have the choice for our sessions if I didn't feel up to doing EMDR, which for those listening who don't know, it's a specific technique using light and dots and eye movement that helps essentially reprogram part of your brain. It's really effective for people with PTSD. And so, but at a certain point, like one session I showed up to, and at like our appointed time, and told her when I got to the session that I wasn't feeling up to an EMDR session that day and I wanted to just do talk therapy. And I just remember her being irritated with me and then, saying that I needed to let her know that ahead of time and blah, 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 even though that was not something she'd ever clearly communicated before. Initially it felt like, well, it's really up to you. And if you don't, this like very comforting, and it's how you feel. And if you don't feel up to it, that's okay. And then when that situation actually came up, she was like, well, no, this was not what we agreed to. This is not what we set up for today. And it was jarring, for me emotionally, because here I was thinking that was an acceptable behavior, and all of a sudden I'm being corrected. And and then at the end, I think we had a total of like 5 sessions, and 3 of those were the EMDR. And when I remember at the last session when I told her like that I thought that I was doing much better and I wasn't interested in continuing sessions with her, that when we signed off, she called me by the wrong first name. And I just remember thinking like, well, I don't need to have any guilt about only, working with her. I think with her, I always got this sense of like, this is her livelihood and this is how she makes money and she needs the clients. And so it just was really tied to the monetary exchange happening. And I internalized that when I was like, I'm ready to stop working with you. I felt like, oh, but this is how she makes her money, and now she's gonna have one less client, and blah, which is obviously not my problem, not how it worked, like not of my concern. But when she called me by the wrong name as we signed off, I just thought like, well, then I can let that guilt go. It's fine. She can find another client, maybe somebody with that name.
Absolutely. And some of what you're speaking to is like the idea of not being listened to in a session, like people getting, especially after 5 sessions, they should know your name by that point, right?
Yeah.
So you sort of wonder where her mind was at that particular time, but also, not communicating really well. So you had one understanding of how this would work, and then when you brought up a different way of wanting to do it, she seemed to think that wasn't what had been communicated. So there's miscommunication happening there, and also just in terms of the repeating of the story. Again, I would encourage anybody who does therapy, if they don't want to talk about something, if they don't feel ready to talk about something, then to communicate that to the therapist. And if the therapist pushes it, they might, encourage a little bit, but if they keep pushing, oh no, you have to do it this way, it's like, no, I don't think so, right? Because you need to be able to work with the person. And you need to be heard. So if it feels like it's too much and you just don't want to keep repeating it and it doesn't seem to be working or helpful, like, say something.
Well, thank you so much, Carol, for coming on to the podcast. I appreciate so much all of your insight, and I will make sure and link some of the Psychology Today that you mentioned and any other grief resources that you think are appropriate for people who are looking for more information. And I can include your contact information. I didn't ask if you're accepting more patients or not, though I'm sure that probably changes, from time to time. So it's evergreen content. I can, if you're listening to this episode long after the recording and you're interested in reaching out to Carol, like, give it a shot. And if not, she has access to a listserv. She can help you find somebody else if she's not available. Yeah,
absolutely.
Well, thank you so much.
Thank you for inviting me.